Dominican Republic Projects is an organization created in the Upper Valley out of an interest on my part to help the people of the Dominican Republic, in particular the community where my mother was born. It is an organization that focuses on promoting self-sustaining programs for the community, where the community identifies and takes ownership of the initiatives. And the focus in the organization tends to be supporting programs in health education and the environment. I was born in the Dominican Republic. By age 12, the dictator had been assassinated. My mother was immigrating to the United States and sent me to live in Cotuí with her family, who were subsistence farmers at the time. It was my experience with living in a subsistence farming environment that brought me up close to understand the plight of the people in these villages. Dominicans are warm, joyful people. Many of these villages, you don't see people being somber. They are living maybe on $2 a day. To us, they're living in poverty, and yet they seem quite rich in what they have. They have a joy and celebration for life that I'd love to share with have people who go with me witness. The recycling plastic idea took off with these women because they saw an opportunity for generating funds. And that was the initial incentive to them. It wasn't my idea of cleaning up the environment, which was my original intent. Their idea was that they saw this as an opportunity to feed their families.
En la calle.
Oh, en la calle.
Okay. The goal is that the women will produce about 12 crochet bags a month, which will generate income for each woman, and they will receive the proceeds from the sale.
Okay, it takes about 125 bags that she finds on the street, and then she washes them and hangs them on the line to dry in the sun, and then she cuts them, and it takes about 125 of these bags to make para hacer solamente uno. Sí.
Over the course of the 14 years, she has real successes. A tremendous amount has been done. And when we went to see the women at La Colonia, they've built a building, they've set up a business, they support each other on a regular basis. They, through their business, have made enough money to help support their families, build a new home in certain instances. That's real success, and they're doing it all themselves. We're partners in this, but they're really setting up their own business, and that's great to see.
Our last day in the town where we were staying in Cotuí, we went out to the women's group again, and we had spent our first day with them. They had a regular meeting that Rita was a big part of, and I was realizing that she was delivering some hard news for them to hear. And what she was doing was actually trying to move them forward into their next incarnation as a group, trying to take the next step in being more independent. And it was specifically around these handbags that they made, where she had been taking them back to the Upper Valley to sell, and the women loved that arrangement. But Rita was saying, no, you need to become more independent. You need to find other places to sell this. And what I was so impressed with in listening to Rita and how she handled that group, because she was compassionate, she was insightful, she was very direct, just all the things you want and need in a leader, saying, I hear what you're saying, but this is where I feel we need to go. Your opinions are valid. It's wonderful that we can talk about our opinions here, but I disagree with you, and this is why I disagree with you. And I was so impressed, and she did that with a smile on her face.
What the group had the opportunity to witness was the growing pains of someone spearheading a program, having planted the seed, and also establish the expectations, but now acting on those expectations. And it was very actively taking that position.
The kids were fabulous. The kids were generally happy, interactive, very open, fun to be with. They all had the same complaints. They all were malnourished. They all had parasites. They all had grippe, which is a cold or the flu or some sort of not feeling real well. So seeing 5 patients at once is exactly like an assembly line. I always started with the older children, and then the younger children could watch and see that this wasn't painful, this wasn't scary. And so by the time I got to them, they knew the whole routine. They opened their mouth, they turned their head for their ears to be checked, they knew what the routine was, and they knew it was going to be okay. It worked very well in families when there was one mother or grandmother who accompanied a number of children. They frequently had all of the same or similar complaints. And then you only had to give instructions once to the one adult. I think one of the good things that we did with our clinics was to involve the health promoters in each of the villages and have them hear our message and hope that they will continue that message after we leave. And I think Rita has seen a lot of progress. The health promoters know the spiel and they're getting comfortable with it, and they are washing their hands. And that gives that self-sustainability that Rita has been talking about for the last 14 years and has been striving for, such that ultimately we can disappear and they can carry on.
There were many events that were spontaneous that popped up. There was a 9-year-old little boy that had his foot caught in the spokes of a motorbike and was carried in literally, right after it happened.
¿Tiene dolor más? Sí. ¿Tiene dolor aquí en la rodilla?
We had some wound care supplies there handy to be able to treat him, wrap the wound, cleanse it, and then send him on to the public hospital to have further evaluation and x-rays. One of the last villages that we held a clinic in, La Catoro, that presented a little girl, I think she was about 2.5, maybe 3 years of age, and her mom was holding her and said, she really didn't know what was wrong with her daughter. She was unable to stand or sit or hold her head up, and she had been that way since birth. Was very well taken care of in terms of cleanliness, and you can tell that she was very loved and cared for by her family. I would say she had cerebral palsy. The mom had gone to a doctor in the past, but was unable to maintain her physical therapy visits into the city. She couldn't afford the transportation. And so I spent some time with her, teaching her some basic range of motion exercises to keep her limbs from contracting and doing gentle passive range of motion with her. She was one of the faces that I'll definitely remember from my experience there.
One of the primary things that I didn't expect was the degree of functional blindness, and that was a big shocker to me. They couldn't see the beauty all around them. For us, we're looking at these beautiful palm trees, and coconuts and bougainvillea flowers, and just a lovely environment that even though they lived in poverty, there was beauty all around them, which they appreciated. I mean, they sang and they smiled and they walked through the campo. But that was what we saw. What they see is blurriness. What they see is, are they grabbing the right thing to cook with? She was actually escorted over because she was blind, and it was very clear, just looking into her eyes, that she had bad cataracts.
La colaboración de la comunidad.
Sí, sí, muy bueno.
Through the contacts that Rita Severinghaus was able to set up through the Lions Club, that they have an ophthalmologist that offers some surgeries, And Rita has the phone number of some of the people in the village who do have phone numbers, and she essentially kept a log of these people for referral, and that we'll get contacts in the future and hopefully get them into the Lions Club clinic. And, you know, it's a very fixable problem.
Pretend germs.
One of my primary jobs was to teach hand washing skills to the village health promoters and children. Hand washing is the #1 way of prevention for infection control. We would take a microbial lotion and have them put lotion on their hands and rub it in. Then I had a black light, which I shined over their hands to see where the lotion, the microbes were in their hands, in the crevices, in little cuts and stuff.
See? Okay.
Then I had them wash their hands, soap and water, and I had them sing the birthday song, 20 seconds, typically 20 seconds.
Excelente.
We would hold their hands after they washed them under a black light, and then we'd look to see if there's any areas that they missed. The idea was to teach the teachers. And so the health promoters are the primary educators in each of the communities. And so if you taught them, then what they would end up doing is I would stand back, and then they would bring in one of the clinics, brought another healthcare promoter in and show her how to do it, with the idea that everyone would learn it, and then they would go out in the community and teach the citizens.
There you go. So 15 to 20 seconds.
And the idea is to show the community how they can be agents of change by learning one basic skill about hygiene. Many of the health promoters, they would approach me or approach the instructors and ask them was there information that they could keep? And we went very ready for that. We made laminated posters that they could then take to their community and have it available as health promoters so that they could show with just the basic soap and water what folks could do. This is the second time that I include breast self-exam in the clinics. Dartmouth-Hitchcock was very generous in contributing the models that were used for that training. We had a nurse who joined us on the trip, Chris, who would spearhead that. And then we recruited a member of the community of Cotuí to assist Chris. The women in the Dominican Republic are not receiving instructions in regular breast self-exam or screening mammograms. So this becomes important in the village communities where they have no access to health care whatsoever. Something like mammograms is at the bottom of the list. So we have run these clinics with the intent to offer education and awareness. There isn't as much follow-up, although we did do a couple of referrals, which is also a wonderful success, where women did discover concerns and then go on to a provider in the community to have a follow-up. And at that point, she's had a little bit more education and information as to what she should have been looking for.
Okay.
Ellen Abrams is about 23 or 24 years old, graduated from the University of Maryland and went into the Peace Corps. And Ellen joined us as an interpreter. She's been in the country, I think, 10 months now. She'd been wanting to join a medical group, so she was very excited to join us. And we were very excited to have her because she could do a lot of cultural interpretation for us. And she lives in one of these small villages. We drove past her house a couple of times. It's the house with the blue door. That's its number. That's its house number. And she is an engineer by training and is working on bringing water to the village that she lives in. The local villagers have some idea of what each well is good for. They have told her, well, this well is good for washing and cooking, but don't drink it. This well is only good for washing, and this well is good for absolutely nothing, She has not actually ever tested any of those wells, I don't think. In spending time with us and seeing just how common parasitic illness is, and as a result, some issues with malnutrition, she is going to go back and test those wells and see exactly what is living in the different wells.
We've probably zeroed in on a source of their parasitemia, and we have the Peace Corps volunteer who just happens to be working on water projects, and she has the ability to run with that. So what we started is going to continue, and her plan is to follow up on that, get the water tested, and if it indeed confirms our suspicions for parasitemia, I think we can affect a change in that village's habits and hopefully use a new water supply, if not figure out how to clean up the water supply they use.
The objective of the efforts that go on there, its goal is to involve the resources in the community. I simply act as a bridge to identifying those resources, and then I connect them. The Peace Corps is a perfect example of that, and we will continue the relationship, I'm sure.
So while we're treating individual patients, we're also looking on, again, on that larger scale and saying, hey, wait a minute, there's an extra circle here we can encompass, and we can bring in the Peace Corps volunteer, and we can check this water, and if we can get them a safe water supply, we've actually affected potentially hundreds of villagers at one time.
The distribution of clothing to children, because it's only to children that much of this clothing is donated. I see the conditions in which children are running around in the community, many of them naked. I don't distribute them. I look to the organization in the town to take responsibility for that. So in this case, it was an organization run by nuns. They know the communities quite well, and they frequently take part in all my efforts and the clinic. They assume responsibility for the distribution of clothing, toothpaste, toothbrush, those sorts of things.
Entra más que él. Venga, ¿dónde?
Ryan has been the best part of our trip. His blog has been fabulous because we've all been reading the blog as it goes, as we go on, and he's really helping us know what we're experiencing.
It was an amazing and incredible experience, and we were given an opportunity that not many people have, and that was to really get to know what life is like in the Dominican Republic. We weren't going to a resort area and being cordoned off from the locals. And I just felt so fortunate and so blessed to be able to speak with people and get to know a number of different people and have extended conversations with them as people. No, en total.
En total.
Okay.
Ay, Dios.
We stayed with a family named Don Gambo and Doña Fina. On Sunday morning, we went to Mass with them, which was great to see the community because during the week we were working very hard and coming back often fairly late in the evening. And so to be able to see the town as more than just the crossroads or more than just the house where we were at, but to see people coming out of the houses and walking to Mass early in the morning and then visiting on their way back through the streets was a really nice glimpse into that town. For me, the heart of the trip and the heart of the work that we were doing was when we went out into these villages in the mountains. And these are very lush areas with dirt roads that quickly become red mud, really off the beaten track. And the people live a very simple existence. And I mean that without saying that this is an existence that you wish you could have. This is a very subsistence farming. There's a word for it in Spanish called campesino, which means people without land. And so these are people who live in very small houses, handmade, usually with slab wood, They have a few chickens, they have some small fields, and they're basically raising the food for them to eat. It's not even going paycheck to paycheck, as I understand it. It's literally going meal to meal. The highlight of the trip was we went to a mountain village called Las Cayamas for a clinic. And just the whole experience there was incredible. Incredible the number of people who showed up. It was incredible the spirit and the feeling in that village. They felt very cohesive. They felt very much, they had their sense of who they are, their identity as a community, and very much that they needed to all be together for survival. The people fed us, the women, to me it was my favorite meal of the whole trip that we had. They insisted that we eat lunch, and there was nothing that would have prevented them from feeding us on that day. And we walked around and talked with some of the people, and again, just very much mi casa, su casa, you know, whatever I have here, please walk around, see, and just welcoming us. These are really amazing people who love their kids the way we love our kids and worry about their future the way we worry about our future, but just strictly by circumstance, by fate, by luck, whatever you'd call it, by God. You know, they live on the top of a mountain and they're going meal to meal, and I live in Vermont and I'm worried if I can send my daughter to a really expensive college or not. But the quality of the people and their compassion and their love and their hospitality. Here are people that we would say have nothing, and yet they're completely giving, and their spirit, their human spirit, is so on the surface, even just in the couple hours we spent with them. It was absolutely a changing experience.
I thought the team responded amazingly well. I thought we kept our sense of humor up. We rolled with the punches. The different skills they have. You know, Jenny and her pediatric skills was amazing, and the nursing capabilities of Chris and Rayanne, wonderful. And Kathy is a brilliant personality who pulled out her nursing history and got back to work and provided an artistic sense. Ryan was administrative at the clinics, and he and Duena set things up and got us our patients, and his interpretation skills were instrumental in our ability to communicate with the population. Duena was lovely. She has infectious laughter, I think we all can appreciate, and her ability to engage the children was really wonderful. She brought these wonderful little red noses that the kids attached as in clown noses, and the giggles that came out of that were great, and it lightened the children's mood, and all in all, I thought the cohesiveness of the team was really special. Everyone appreciated the skills that each person brought to the table, whether or not it was cinematography and writing. It takes all of those skills to get to the heart and core of these villages, and frankly, Rita's invested years of her life to gain the trust and acceptance of these villages, and we wouldn't be allowed access to these villages without that prior investment that she's put her heart and soul into. She has such joy for her country and the folks in it, and a memory bank of her childhood here that she brings with her, and you know, she knows how fortunate she is, and she'd like to impart that on the people almost she left behind.